Hi everybody, in today's video we'll be talking about knee OCD in the knee, or Osteochondritis Dessicans. I'll talk about what it feels like, and I'll even explain it with a diagram of the leg. So with that, let's get right in. Knee OCD has affected my leg for about 8 months now, and so it really matters to me why um, I need to share this with you guys. And so I'm doing this because there's a very little amount of research on knee OCD, and I wanted to get the word out and help other people know that it's there, and if you have it, other people have it too, so there's nothing to be worried about. And if you're early stages, then I can explain further to you what is knee OCD, or osteochondritis dissecans. With that, let's talk more about the knee. So this is the knee. You can see nothing too special. It's pretty simple, actually. You have your knee bone. This is your shin bone. This is your patella, or your kneecap, your femur, your tibia, and your fibula. Okay? Right. So those are just some bones. Then this blue stuff in here, that's cartilage. That's your meniscus. Meniscus is what lubricates your joints so that it's easy to move. And these are your muscles, these yellow things, muscles and tendons. So I'll talk more about what they play a role, how they work, and all of those things, and how does that link to osteochondritis dessicans. So this is your quadriceps, this is your IT band, and your ACL, LCL, and deep down, that's part of your ACL. This part is generally uncovered. We'll be using the back since this part is a little bit, the front is a little bit covered by a quadriceps. So this is pretty good idea. Still same femur, shin bone, and so yeah, this is your, obviously, as I said, meniscus. Then this is your LCL, ACL. And so then where you get osteochondritis dessicans, they look from the side view, right? This side is actually better. And so the most common spots are right here around the weight bearing area, and then right here. Some people also get right here on the lower areas. And so it's not uncommon to get it here or here, but it's more uncommon to get it here, as there's um, less probability that you are going to get it here. And so basically what osteochondritis is that it's cartilage that is breaking off, and it's basically like a parrot beak shape that's poking into your knee and the bone. And so it hurts, and it's easy to spot, and they put an x-ray in. Sometimes it's visible. If it's more of a bone issue, then you could probably find it on the x-ray, but if it's a cartilage issue, then you have to find it on the MRI scans. And so basically what the problem is usually it's linked to a thick meniscus. In my case, yes, it's a very thick meniscus bone. Meniscus cartilage piece, and then the bone obviously was getting damaged. So you could see that, and basically what they do is they will shave that little parrot beak off with a little grinder, and then they will reshape it into a C. When it's a discoid meniscus, it is actually more of a disc shape instead of a C, and that causes it to break off and make that parrot beak shape. We don't know why. Osteochondritis dessicans is still very under researched, and so the bone gets affected, and when they do the surgery, like they did with me, then they make little holes to stimulate the blood flow. And then if you're taking non-surgical route, then the hope is that with little weight bearing, that it will calm down and the cartilage will heal and get pushed back down into its place. Sometimes that's not the case, and so say this is your knee, then it's right here, and that is right there, still continuing, is getting pressed, pressed. So right there, pressed. And you see how that cartilage is gonna come off. So it's makes sense why it can happen. Sometimes it's genetic, sometimes it's because of weight bearing. So yeah, that's a basic idea of what OCD in the knee is. With that concludes our video. If you have any questions, please ask in the comments. And before we end, I want to say thank you to the ROCK organization of Osteochondritis Dessicans. They have a great team of doctors, and go check it out. Thank you for watching.